Our next guest today is Dr. David Snow. Welcome to the show today, Dr. Snow. It's such a pleasure to have you here.
Thank you for having me, June. It's a pleasure to be here.
Thank you. Now, I understand that you recently opened a new practice, so tell me more about that.
We are really excited about opening a arthritis practice to service the Cape Fear area. We're going to be just outside of Brunswick County near Delco, North Carolina.
Right. And that's on 74, is that correct?
On 74, yes.
Yeah, wonderful. So I know you're a rheumatologist.
Yeah.
And so let's talk a little bit about what that is. What really does a rheumatologist do?
Well, that's a good question because many people don't know what a rheumatologist is. And actually, when we formed the name, we decided it would be better to be Cape Fear Arthritis Care rather than Cape Fear Rheumatology. But rheumatology is basically the medical management of aches and pains. We are non-surgical, and we deal with all types of aches and pains from inflammatory arthritis to degenerative arthritis to bursitis to tendonitis to pain management, pain perception syndrome. So really kind of cover the gambit of aches and pains medicine. Mm-hmm.
I'm curious, was there one particular thing that helped you choose rheumatology?
I worked with Dr. Crone in my residency at Allegheny General in Pittsburgh, and he was a rheumatologist, and he kind of sparked my interest. I've always had an interest in musculoskeletal medicine, and just working with him kind of gave me an outlet for that. The other option for musculoskeletal medicine is surgery, and I'm not very surgery doesn't excite me. So it was good to have move in a direction as far as musculoskeletal medicine, and really help people with aches and pains. I really enjoy that.
Mm-hmm. Now, you said you did your residency at Allegheny General in Pittsburgh.
Yes.
Where did you go to medical school?
I went to medical school at the University of Toledo in Ohio, Medical College of Ohio. And then the residency at Allegheny General and my fellowship at the University of Pittsburgh.
Good credentials.
Yeah, thank you. Thank you.
So what would be some of the most common conditions that you treat?
We treat all kinds of things that cause aches and pains. We treat osteoarthritis.
Okay.
I usually divide things into three broad categories of things that cause aches and pains. There's inflammatory arthritis, which is rheumatoid arthritis, lupus, gout, psoriatic arthritis, and these are conditions where, for one reason or another, there's inflammation in the joints. Then there is osteoarthritis, or wear and tear arthritis, where there's breakdown of cartilage and the joints are breaking down. Unfortunately, the only way to fix that is surgery, but we can help people live with it better. Mm-hmm. And then the other broad category is pain perception issues, things like fibromyalgia and myofascial pain. We help patients with those as well.
Mm-hmm. I'm curious, talk to me a little bit more about rheumatoid arthritis. I hear that term all over the place. So, everybody says, oh, I have rheumatoid arthritis. And I have arthritis in my knee, but it's just regular arthritis. And so what's the difference between that?
Well, that's a very good question. We get that a lot. Many times I'll have a patient come in and says, my knee hurts. Is that arthritis? And we need to get into a little bit more there. One of my pet peeves is a patient goes to the doctor and says, my neck hurts, and the doctor does an x-ray and says, you have arthritis, and the patient leaves. And that really doesn't do a good service for the patient because as we get older, we get wear and tear changes that show up on x-ray. But that doesn't necessarily mean we're going to have pain from them. The arthritis was there 2 weeks ago, but the pain started a week ago. So there's some dynamic there. And rheumatoid arthritis is one of the inflammatory arthritis. It's an autoimmune disease where the immune system is affecting the joints. So you get inflammation, swelling, there's signs in the body that the immune system is activated. And it's actually the inflammatory arthritis category is the conditions that we can do the most about. Those are probably the most satisfying conditions to treat. They do require medications to control them, but we can actually do something about what causes the arthritis. Where the other two categories, it's a little bit hard to do anything about what causes the arthritis. It's more of learning to, or working with improving symptoms, but not changing the process.
Mm-hmm. Well, let's talk about treatment a little bit. How would you treat one versus the other? What would be some of the common treatments?
For inflammatory arthritis, we use things that calm down the immune system. Initially, sometimes prednisone, and that is a dirty word. I understand that. Everybody likes to stay away from prednisone, but using it judiciously and carefully, it is a very good tool and has less side effects than Motrin and the anti-inflammatories. And then we move into medications that slow down the immune response. And many people have seen the ads for Enbrel yes. So those are medications for inflammatory arthritis. Gout is something that we see a lot of. And it's kind of a fun condition because it's such a straightforward condition. It's one of the easiest things I do, but it's one of the things that can be.
You get that in your big toe, right?
That's where it can start, but it's not. Doesn't mean
okay.
Yeah, 50% of the time is there at presentation. 80% of the time, at some point, they have it in their big toe. And not all big toe pain is gout, and that's another thing that because it's a very common place for osteoarthritis as well. For osteoarthritis, wear and tear arthritis.
Yeah, I'm most interested about that.
Yeah. Well, it's really exercise is very important. Strengthening muscles, staying active. Yeah, and not knees are very common, and the one thing that nobody wants to hear is weight loss. But the knees see 4 times the body weight.
Now wait a minute. Are you saying I need to lose weight?
I was talking about people in general. The knees see 4 times the body weight. So if you lose 10 pounds, it's 40 pounds off your knees. If you lose 20 pounds, it's 80 pounds off your knees. Yeah. And that is the biggest risk factor for osteoarthritis in the knees and the thing that can make a big difference. We try to get patients into an exercise program, strengthening the quadricep muscles, help to stabilize the knees. We use topical agents, anti-inflammatories, which are creams that you rub on the joints. We use oral anti-inflammatories. They just have a lot of side effects, and it's an adjunct, but a combination of different pain relievers, adjusting activity. One of the things that we want to do at Cape Fear Arthritis Care is work on a more integrated approach. We're going to have physical therapy, and helping people understand what's going on with the arthritis, and some education.
Education is so important.
Is so important, and it makes a big difference in if people understand it and are a part of the therapy. Then there's some empowerment there, and that makes a big difference as well.
So you mentioned physical therapy. You're going to have that on site?
Yes, we are. Lisa Schaefer's somebody I've known for a long time, and she's worked on some of her own techniques for physical therapy, and so we're going to have that available. And very excited about that. And hopefully as we get started, we'll bring some more things on board. Right now we're just excited to get the whole thing up and running and going.
Right. And now will you be open 5 days a week?
We're going to be open 5 days a week. We're going to have evening hours on Tuesday. We're going to do every other Saturday.
Oh, that's awesome.
Yeah, so a little bit more...
very patient-friendly.
A little bit more patient-friendly. I think we think alike here. Yes, patient-friendly. Our motto is where the patient comes first. And I think that sometimes in the modern healthcare, the patient is as much a commodity as anything else that goes on, and we're moving away from that as a theme. And I hope we can. There's a lot of forces that make it difficult to do that, but I hope we're successful.
Well, that's great information. One other question: do you need a referral to see you?
As long as your insurance doesn't require a referral, we don't require a referral.
I see. So they don't need to get a referral from their primary care physician.
No, they can just call our office. Yeah, they can just call our office, and we'll set up an appointment. We'll try to make it as easy as possible.
Great.
Yeah.
And again, your practice is located in Delco?
Just outside of Delco.
Outside of Delco.
27056 Andrew Jackson Highway East, Suite 2.
Suite 2.
We're here to help.
Great. Well, it's been a pleasure having you on the show today.
Thank you, Jen.
Great, valuable information, and I know we've got viewers out there who will be giving you a call. We're all, we're not getting any younger these days.
Yeah. Well, it's not just, wear and tear arthritis is more common as we get older, but lots of people have aches and pains.
Yeah. Well, great. Thanks again for being here. I look forward to hearing how everything's going.
Thank you. I'll let you know.
Good.